Hi, everybody, and welcome to Public Health Leadership and Management. This class was developed as a team effort with the faculty in the Department of Health Policy and Management and with substantial input and help from our colleagues in the Department of Environmental, Occupational, and Geospatial Sciences. The specific instructor for your class will have an introduction posted on the course website. And if you want more information about our faculty, you can go to our website. This class will help you to do a number of things that are listed as key CEIF competencies. It will help you to discuss the public policymaking process, to compare healthcare, public health, and regulatory systems across national and international settings, to apply principles of leadership, governance, and management to real-world situations, to apply advocacy, negotiation, and mediation skills to address organizational and community challenges, and to explain the basic principles of budget and resource management. Now, that's a whole lot to do. So why don't we start with a short breathing exercise that can help us to de-stress. And this is something that you can put in your pocket and use whenever you're starting to feel stressed out by the coursework or by life. So we take the tip of our tongue, put it right behind your front teeth. We're going to breathe in through our nose for a count of 4. We're going to hold for a count of 7. And then we're going to breathe out for a count of 8. So it'll look something like this. So I'll start. Okay, do that 2 or 3 more times, and then we'll get started. Part of what we wanted to cover in the first class is just some basic background that you'll need to be able to enjoy the class throughout the rest of the semester. And the first thing I want to talk about are models, because we use models all the time in public health. But really, what is a model? You know, it's not fully realistic. For example, look at the toy car I have up there compared to the real convertible, right? That toy car does not have all the pieces of the convertible. It doesn't have an engine, there's nowhere to put gas in, but still, it doesn't capture every aspect of the reality. But it can still give us a structured way of thinking about cars, which is what models do. They give us a structured way of thinking about reality through simplifying it. So we can talk about the shape of the car, about the wheels, about the steering wheel, about, the movement of a car. Ideally, a model is going to capture the main aspects, but I just want you to keep in mind it's not going to capture everything. So one of the models we use in public health, and you'll see this in several of your classes, is the socio-ecological model of the determinants of health. And what this model basically says is that what determines how healthy we are depends on, yes, our individual attributes, but also depends upon things larger than ourselves, depends upon what our communities, our neighborhoods, our living and working conditions, the larger environment, and that these things together determine our health status. So when we're trying to talk about the health of the population, we want to be able to affect things at all different levels of the socio-ecological model that determine health outcomes. Unfortunately, however, the version of the socio-ecological model that is used in a lot of public health practice leaves out the environmental determinants of health. So while for our purposes in this class, we will largely be focusing on the organizational, community, and policy levels, we're also going to have a session on environmental health, and I'd like everyone to keep in mind that the physical environment in which we live and work is a strong determinant of our health, and that environment itself is affected very much by organizational, community, and policy factors. It's just that many of the models that you will see, for whatever reason, and I'm not sure why, fail to include the environment. So really, we're going to be using a combination of the two models this model you can think of as being a great expansion of that outer circle of the previous model. So why does this course matter? I know that a lot of you are here because you have to be. This is one of the required courses. But I want you to keep in mind this course matters because it will explain to you how you get paid. If you work anywhere in either the healthcare delivery system, as a provider, as a manager, as an administrator, or if you work in the larger healthcare system, um, within governmental agencies in public health, in the New York City Department of Health and Mental Hygiene, or if you work in areas that we don't typically think of as public health but are, such as the Food and Drug Administration, the USDA, any of these areas are going to be greatly affected by health policy, and the way that your money will get to you is going to come through either the health system or the healthcare system. And we'll spend more time in this course talking about how money in the healthcare system flows, but this course matters because it talks about where your dollars come from. So we also spend a lot of time on public policy and the policy process in this class. And you would say, why public policy? Isn't this a course on the healthcare system? Well, public policy is what creates the space, the legal space, sometimes the physical space, and provides the money for what we do in public health and how we regulate the healthcare system. Implementing social justice changes in society usually depends on government action, and government action starts with public policy action. We also spend time in this course talking about advocacy. And why? Because advocacy is something that everybody can do. Advocacy is action directed at making social changes. It's a skill you can use throughout your career, and we need you. We need the voice of public health experts to ensure that public policy decisions really reflect what's best for the public's health. Advocacy is how we make the bridge from everyday people and from science and evidence to the public representatives in the legislative, executive, and judicial branches that make, implement, and educate our policies. Now, in this class, we'll talk about the health system and the healthcare system. A lot of times we use these terms interchangeably, but the health system implies a broader range of determinants. The health system has components outside of the healthcare system. Think about public health departments and restaurant inspections, for example. The healthcare system is those set of actions and activities that are really concerned with prevention and treatment of illness and disease. Now, the health system is only one determinant and not even the largest one of a population's health. If we look at this diagram from the World Health Organization, you can see that the health system is down in the bottom right corner as one of many factors that determine the health of a population. I'd like to spend a few minutes going through an overview of healthcare delivery systems to help us set up for the class. Now, healthcare delivery systems are the way societies provide services to meet the health-related needs of individuals. Now, ideally, they're like this beautiful watch, a network of integrated components designed to work together coherently and precisely. Now, the ultimate purpose of a healthcare system is to improve the health of the population. It's to enable all residents to receive healthcare services, although in practice, many countries limit this to citizens. The purpose is to deliver services that are cost effective and that meet established qualities of care. And if you look at the accompanying graphic, you can see that the US, compared to literally every other developed country, is performing very poorly in all these areas. When we talk about a healthcare system providing care, the goal is to provide care that's of high quality, to provide prevention services, to make sure that everyone has access to that care, that it's cost effective, and that it's equitable. And what you see here is the quality triangle from the Institute of Medicine, which we'll be talking more about later, which talks about these 6 components of quality in healthcare. This is the model that we're going to use to talk about the healthcare system. Now remember, I had talked about models as simplifications of reality, so of course this model doesn't cover every piece. Don't worry about knowing about all of it now. We're going to spend a couple of weeks going through the different components. But the She-Quad function model provides a good way to break down the healthcare system into a way we can understand it. So we can talk about the financing. Where does all the money come to pay for healthcare? We can talk about the insurance part of the system. It's a way that we pool the money to protect people from catastrophic risk. We can talk about the payment. Well, how do we get the money from the patients to the providers? And finally, we can talk about the delivery of healthcare, the healthcare workers, the settings they work in, and the care that they are legally allowed to provide. So, does the US have a healthcare system? Meh, not really. It's kind of like the broken watch up there instead of that beautiful one. We have a hodgepodge of financing, insurance, delivery, and payment mechanisms that are unstandardized, that are loosely coordinated, and it's functionally fragmented because our healthcare system has no overall planning, direction, and coordination from a central agency. I mean, we have pieces. We have Medicare, we have the Veterans Administration, and we have lots of private insurers, but we don't have any one government agency that coordinates all of it. And we're unique in this among developed countries, actually among most countries. We're not a single system. We're not financed by any kind of taxes. There's no universal entitlement to healthcare in the US, and we've got many issues around cost, access, quality, and equity. And again, we'll talk more about these in detail, but I did want to lay out the basics before we started. Now, it's not all bad. The US healthcare system is a leader in many ways. We lead the world in medical technology. We lead the world in medical training. We lead the world in research. Most pharmaceutical research is conducted by US companies. We have incredibly sophisticated institutions, products, and processes. Our challenge is we have all of this great stuff, but we can't get it consistently to the people that need it. So what's the issue? Why not? Well, we're back to policy. In the arena of healthcare delivery, every city, every state, and every country has to decide through its elected government how much does it want to spend on medical services? What kinds of services does it want to provide? No country provides unlimited services. No country provides every medical service to every person that wants it. All of the countries that have organized systems make critical decisions about this. We also have to decide, how do we want to produce these services? Do we want to have doctors provide all the care? Are we okay with nurse practitioners and physician's assistants? And finally, how are we going to get all these services to the people? And we do all of this through legislation or through a lack of legislation. A significant problem in this issue is the idea of what's fair. So those of us who engage in social justice activities will say it's not fair that people don't get the care they need. But how we define fairness depends upon our orientation. So if we have a market justice orientation, market justice places the responsibility for the distribution of healthcare on the market forces in a free economy. So in short, you can get the healthcare that you earn, you can get the healthcare that you can pay for, and the market is thought it'll adjust the prices up and down, just like it would for computers or cell phones or jeans. So thus, people with a market justice framework feel that interfering with the free market is unfair to the businesses involved. Now, social justice, on the other hand, emphasizes the well-being of the community over that of the individual. So the inability to obtain medical care is seen as an injustice, and it's seen as not fair to have people go without the health care they need. Both of these viewpoints have challenges. In the market justice one, the challenge is pretty obvious. We have lots of people who get sick, linger with chronic illnesses, who die prematurely because they don't get the care they need. But social justice also has challenges. The social justice framework, the big challenge there is who gets to decide. Who gets to decide what kind of care we're going to provide? Who gets to decide who we're going to provide it to? And so both systems have challenges, but public health pretty much endorses a social justice viewpoint of fairness and of what we should be doing in healthcare. Okay, so I think we really covered enough background to give you all a sense of what this class is about and what some of the frameworks that we'll be using are. So now let's talk about our first class. The focus of our first class is team building. You'll have a group project that is worth about half your grade that you will be doing with your group over the course of the semester. But your groups will not be randomly assigned. You're going to take something called the DISC Foot Profile. You'll find it in the Week 1 folder, and that will tell you about your teamwork style. And I'll let you discover that on your own through going through the DISC materials. Once you take the profile, post an introduction, be sure to include your DISC numbers, and talk about whether or not you feel the DISC was accurate. And it's perfectly okay to say it does not represent your style, but please tell us what your style is. Because the next step is for everybody to go ahead and read the instructions and choose 5 people they want to work with and let the instructor know through Blackboard. The groups will be formed fairly quickly, and the goal will be to have a mix of teamwork styles in each group and to make sure that every single person in the group is working with at least one other person they chose to be with. And finally, be sure to take quiz 1. That's all for this lecture. If you have any questions, please post them to the Q&A section on the Blackboard site. Also, feel free to reach out to your instructor directly via email if you would like to meet via Zoom or phone. Take care till next time.